Healthy Living in the Four Corners has been brought to you by San Juan Regional Medical Center. In today's Healthy Living segment, we're taking a closer look at urology, a subject that frightens so many people that they delay going to a urologist when they have symptoms that indicate a problem.
Dr. Manis, nice to meet you.
Daniel Manis and his partner Chris Taylor are urologists at San Juan Health Partners Urology Clinic in Farmington. Their practice is open to everyone with or without a referral whenever you need answers about your symptoms.
There's a lot of symptoms, men with difficulty urinating, waking up every 2 or 3 hours at night to pee, women who are leaking urine. Oftentimes I find that women with urine leakage just wear pads and think that that's just the way it's got to be, but that's not the case. So oftentimes we can help with that, if not fix it completely.
With women, we see more stress, incontinence, urgency, urine infections, postmenopausal changes that need to be addressed. Common issues for men would be erectile dysfunction, abnormal blood tests checking for prostate cancer. Prostate screening we're also happy to do, though most primary cares do that.
And then they refer something that's abnormal to us. But of course, if somebody doesn't have a primary care doctor and you're a man between the age of 50 and 75 and you're interested in prostate cancer screening or something like that, you could come see us.
Our recommendations, and I think really standard recommendations from across the country, urologists across the country, would be starting screening somewhere around 55. And that involves a digital rectal exam every year and a PSA test usually every 2 years is plenty.
So essentially a urologist is the surgeon that works on the urinary tract. So I always tell patients we're basically a glorified plumber. What kind of problems are you having?
At San Juan Health Partners Urology Clinic, the doctors see men and women in almost equal numbers, but they agree that it's often harder to get men to come in.
Men are definitely worse with it than women. That's something that I've noticed. So it's usually the wives that are prodding the men to get in to see us.
I think that's for a couple reasons. Number one, the topic matter can be personal. People have a fear of being poked and prodded, as they would say to me sometimes. But here in the clinic, most things we do are non-invasive, and the things that are invasive we talk through. And patients do very well, whether it's having a look in the bladder for recurrent infections or blood in the urine, or vasectomies, which patients are notoriously scared to do, and I understand that, but they overwhelmingly do very, very well.
Both doctors say that there's one symptom you should never ignore.
Anybody who sees blood in the urine should definitely come and see a urologist, because blood in the urine that you can see is actually the number one, that's the most common presenting sign of bladder cancer, and that's usually the only presenting sign.
Blood in the urine can be the first sign of a cancer that if found early can be treated, especially for smokers or older patients.
Most people near retirement age will probably need to see a urologist at some point in their lives, but we can avoid them by living healthier lives.
Okay. How old were you when you first got kidney stones? Stones, for example. Stones form much more quickly when you're dehydrated. So staying hydrated is important.
Maintain a healthy lifestyle, get exercise, eat well, maintain a healthy body weight.
Fruits, vegetables, low fat.
And those are going to help not only with urologic issues, but with your overall health.
San Juan Health Partners Urology Clinic welcomes all patients, but check your insurance plan because some insurance companies may require a referral from your primary care physician.
We're happy to see somebody if they're having an issue, and it might take 3 weeks to see their primary care, and we can see them this week. Why not have them bypass that step? So that's something that's absolutely acceptable, and we're happy to do.
More information may be found at sanjuanregional.com. I'm Deborah Uroda for this edition of Healthy Living in the Four Corners.